Opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Ant2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor. We are sponsored by All County Healthcare. We're a certified home health care agency servicing Palm Beach County, Broward, and Miami-Dade. You can reach us directly at 954-717-7027. And tonight we have Dr. Andrew J. Lovy, and he is at the Paley Orthopedic and Spine Institute. And the address is 9960 North Central Park Boulevard, Suite 150A as in Apple, Boca Raton, Florida, 33428. You can reach them directly at 561-922-9112. And the website is www.paley.institute.org. And yeah, really quickly, Dr. Lovy is a fellowship-trained orthopedic surgeon specializing in hand, wrist, elbow, and shoulder surgery. He's skilled in the treatment of arthritic and complex traumatic disorders of the hand, wrist, elbow, and shoulder, offering the latest arthroscopic and minimally invasive treatment options. And Dr. Lovy will tell us a little bit more about what his interests are. So thank you for joining us on the show today, Dr. Lovy. We appreciate you. Can you hear me?
Yeah, it's my pleasure. Thanks so much for having me.
Absolutely. We know you're so busy and appreciate you taking time out of your busy schedule. And can you just share with us a little bit about your background? Where'd you go to school, and what made you decide to become a doctor and then into orthopedic surgery?
Yeah, absolutely. So I grew up in Seattle, Washington, and I always liked to try and fix things. I was always rebuilding and refinishing basements with my dad as a kid, and then my buddy and I, we put together, we rebuilt a couple Mustang fastbacks when I was in high school, and I always liked building things, working with my hands, and my dad was a doctor, which always kind of got me interested in medicine and science, and then orthopedics just made sense to me. You know, it was a lot of the same stuff, carpentry almost at times, and, you know, structure and function, and I got hooked.
That makes perfect sense.
So yeah, and then so I grew up in Seattle, but then I did really all of my training out in the East Coast. I went to college in Boston, did my medical school in New York, and then residency in New York, stayed in New York, met my wife in New York.
Oh,
and
nice.
then I like to joke that after about 10 years, I was able to convince her that she didn't want to live in New York anymore. And now we're down here in South Florida, and I am not looking back. I love it down here. It's a wonderful place to live. We're very grateful that we're down here in South Florida now.
And we're grateful to have you in South Florida because from what you do, you really would be able to serve our community. I mean, what are some of the most common injuries that you encounter in your practice?
So I'm, specifically, I'm an orthopedic surgeon, and, a lot of us are able to take care of there's some basic bread and butter orthopedic issues, but I think one of the nice things now in South Florida is that, as our population has grown and our doctors are getting, we're getting more and more new docs in the area, and a lot of us are now really specialists and fellowship trained, so you have the opportunity to see, the best and brightest in your fields here in South Florida, which is wonderful. So my specialty is hand and upper extremity. So I did a fellowship at the Mayo Clinic, and we focused on, traumatic and complex disorders, and even also the common disorders, of course, of anything from the fingers to the shoulder. So, I see things as, common as carpal tunnel, trigger fingers in the office, shoulder arthritis, rotator cuff tears, to really complex nerve injuries and major reconstructive procedures in the office as well. And, it's really rewarding.
Yeah. So, Dr. Lovy, as an orthopedic surgeon specializing in minimally invasive techniques, could you explain a little bit more about how these approaches have revolutionized the field of orthopedic surgery, particularly in hand and upper extremity procedures?
So, yeah, I mean, for probably, but really since I've been training, arthroscopy has been a big thing. It used to be like, for example, rotator cuff repairs are done through an open incision, but I got to tell you, I've never had to do an open rotator cuff repair because
Really?
from my time as a resident, we were doing things arthroscopically, and even right now. So, it really cuts down on the, surgical trauma to patients, which allows them to have oftentimes you see a quicker and easier recovery process. And also from a cosmetic perspective, folks like that quite a bit too. And I think anytime we can be, less disruptive to the normal anatomy and normal tissue, people are going to have a better outcome. And I think the other thing though too here now that things are changing, at least in my practice and as my hand surgical practice, is that it's not so much necessarily the incision size, but we're changing the way we do surgery. So it used to be that folks would have a trigger finger or carpal tunnel release done under anesthesia, meaning they'd be asleep. But we're learning more and more that there are so many different common hand, wrist, elbow procedures that can be done under local anesthesia, which allows us to have our patients awake. And for example, in the case of like a tendon repair, if somebody were to cut themselves cutting an avocado in the kitchen and they slice their tendon, we are able to have the patient be awake during that operation. We numb up the fingers so they have zero pain. We give them some headphones and listen to their favorite music in the background. And that also allows us to have them participate in their procedure. So once we finish sewing the tendon, we can confirm with the patient then and there that it's moving perfectly. So it can really help us improve our outcomes for the patient. And folks love it because they don't have to undergo anesthesia. Because if you don't have to wake up groggy and have a tube in your throat or be exposed to those risks, it's really wonderful.
That's amazing because, typically when we think of, an orthopedic, or at least me, I'll speak for myself, right away, orthopedic surgeon, I'm thinking all these invasive, things maybe from 20, 30 years ago. But it sounds like really the whole all of the procedures and everything has really evolved in such a way where it's much more minimal and much more interactive with the patient. Like you said, they can kind of get back to.
I mean,
Go ahead.
For sure. And if you, again, for me, it's like to show the patients then and there at the time of surgery what my expectations for their functional outcome is going to be. And if they see their finger moving all the way open and all the way closed for the first time in like a week since they cut themselves, they understand what they can achieve. And I think psychologically it helps them with the recovery process, knowing that, hey, this is what my doc got for me in the operating room. If I work hard in therapy, that's what I'm going to get in the end.
Wow. So can you tell us a little bit more about targeted muscle reinnervation? And I'm reading here, it's an innovative technique for improving the function of prosthetic limbs. Please share about that. I have a friend who is an amputee, and I think she'll be listening and be interested in learning about this.
Yeah.
So can you share?
So this is another really cool, absolutely. So, one of my passions is nerve surgery. And, most of the, there's a lot of different fields that do nerve surgery. I think there's sometimes it's plastic surgeons, sometimes, it's usually plastic surgeons or hand surgeons that are doing this stuff. And, there's this new technique called targeted muscle reinnervation, which I think it really came out more popularized in the last 10 years. And the idea that happens here is when, some folks have traumatic injuries, they unfortunately can end up as an amputee, or you can have just some kind of simple trauma at home where you ended up with a nerve injury, or, unfortunately, sometimes folks do have nerve injuries from surgeries. And what happens is once you have an injury to a nerve, that nerve, or specifically, let's say, there's two ways that the targeted muscle reinnervation is used for. One is for amputees, and the other focus is for people who have neuroma pain, which is where when a nerve is severed, the nerve wants to do something. The nerve is trying to regrow. It's one of the few tissues in our body that can really regenerate itself. But if the nerve doesn't have another clean nerve end to grow into, it can form a big scar ball called a neuroma. And those neuromas can cause severe pain. So a lot of amputees have these hot spots where it prevents them from wearing a prosthesis, or they have terrible phantom limb pain. Yes. Or it's somebody who just had a simple, not necessarily didn't have an amputation, but they had a nerve injury and that nerve didn't heal right, and they have terrible burning pain in their forearm or in a nerve distribution. So the idea behind targeted muscle reinnervation is twofold. So with amputees, it can sometimes enhance their prosthetic function because we can use that nerve that has no target and plug it into a muscle that's still existing by the stump, and that can provide additional feedback into the new prosthetic limbs that we have to offer finer motor and muscle control. And then at the same time, it can also be done to treat a neuroma pain in amputees, because nerve is looking for something to do. And the idea is that if a nerve doesn't know what to do, it's going to grow this scar ball or neuroma, which sometimes can be the size of a golf ball, but usually it's more like the size of a pea. But that can create a severe hot spot for a patient. Right. So what we do is we go in and we cut out that neuroma and we repair that nerve into another nerve ending into the muscle. And miraculously, this thing can sometimes just get rid of folks' pain of phantom limb pain, like upon waking up after surgery. And it's really incredible to see, a patient's relief from horrible neuropathic pain.
Oh, wow. Your patients must love you, because I know I know a couple of people who've suffered from nerve damage, and I know that it's a horrible thing. So this is amazing. Do you do that? You said you is it with a laser, or you actually go in and just reattach it?
This is, it's a real surgery. So this is not like one of, there's some things where we have minimally invasive options and things like that, but this isn't one of those. This is where, but the reward is immense when you have folks with terrible, neurologic pain, because that can be debilitating and there's no other good answer for it.
Absolutely.
But no, it's a real surgery for sure. And, it's done very carefully. We have to use a microscope to be able to transfer these nerves. But when folks have bad neuropathic pain and bad neuroma pain from nerve injuries or amputees, it's a remarkable new technique that we have.
Wow, this is fascinating. I mean, and with the demographic that we have here in South Florida, your services, what you do, is so needed for the community. So really, we want to thank you for that. Yeah, and so also
Absolutely.
I'm looking, so the arthroscopic surgery that's becoming increasingly popular for various joint-related issues. Can you take a minute to explain about this technique, and how is that utilized in treating conditions in the hand, wrist, elbow, and shoulders?
Yeah, no, I mean, I think the place where it's really taken off, for sure in the upper extremity more than anywhere else, and really widely accepted everywhere, is the shoulder. I mean, it's kind of become the gold standard there. Like I said, we're doing all of our rotator cuff repairs arthroscopically. We're doing fractures in the shoulder arthroscopically, sometimes in the right setting. We're doing shoulder instability repairs arthroscopically, and we're really improving our outcomes in those procedures. And then, we also, we do it in the wrist, we do it in the elbow, and sometimes we can even do it in the small joints in the hand, even into the knuckles in your fingers if you really need it under certain indications. And again, it's nice because, you keep the incision sizes down sometimes, and it allows you also to really visualize the joint surface. We're doing it sometimes in the setting of fractures in a wrist that's really blown to a lot of pieces. And by sticking a little camera inside there, you can verify that you have a clean, smooth joint surface and you restored the fracture alignment the way you want it.
Wow. That's amazing. And so I know a lot of people who like work from home where we're working on the computer all day. We
Yeah.
have these carpal tunnel syndrome issues and things like that.
Yeah.
How do you approach the management of these conditions, and when would you know when it's time to actually do something a little more invasive? Because I know a couple of people who do have the carpal tunnel. So yeah, if we can talk about that for a minute, it would be great.
Yeah. So no, I mean, certainly we always, for all of human history, we've been using our hands, and there's always been different repetitive motions that we've been doing, and there's different tendinitises that develop as a result. And carpal tunnel has been around for forever. I always tell folks it's predated the computer for sure, but in the age of the computer, we've started to understand what it is a lot better. But carpal tunnel specifically, those are syndromes where you get numbness, burning, tingling in your thumb, index, and middle fingers. It'll wake you up in the middle of the night, like you feel like you got to shake your hands out, run them under cold water, sit on them, do something funky with them to try and get your fingers behaving again. And oftentimes in the beginning, when your symptoms are only more intermittent, I tell folks just get a simple brace off of Amazon, $10-15, wear it at night when you're sleeping. And if that quiets down that burning and tingling in your fingers, then you're really okay to begin with.
Okay.
But where I get more aggressive with it is when people start to get more permanent numbness, throughout the daytime, and it's not just intermittently at night. So if you're feeling like you can't feel your thumb or your index finger or middle finger the way you used to, that's when you really need to have somebody take a look at it, because that symbolizes a greater constriction on your nerve. And then we worry if some of that loss of sensation is going to become permanent, which nobody wants.
Oh, yeah, for sure. We're going to take a quick commercial break, and we'll continue the conversation. We'll be right back, Dr. Lovy. Quick commercial break for everybody.
Looking forward.
Okay, we'll be back in a minute.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thanks for tuning back in to You and Your Doctor, sponsored by All County Healthcare. You can reach us at 954-717-7027. And we are welcoming back Dr. Andrew Lovy. He is right here at 9960 North Central Park Boulevard, Suite 150A, Boca Raton, Florida, 33428. Phone number is 561-922-9112. And the website is Paley, P-A-L-E-Y, institute.org. Thank you for joining us again, Dr. Lovy. We appreciate you taking the time out of your busy schedule, so we really do appreciate that. I think we were discussing...
Absolutely. It's a pleasure to be here with you guys.
Thank you. I think we were wrapping up with the carpal tunnel, and you made a really good recommendation to get if it's like the beginning stages, you said to get like an arm or a hand brace like off of Amazon and just sleep with that at night.
Yeah,
Right.
exactly. That's the first simplest stages of it. A lot of us get that sometimes. You wake up, you feel like your fingers feel a little bit fuzzy or whatever. And if it's only every now and then, you don't have to rush into your doctor's office. Buy a brace on Amazon. See how things go. And if you're sleeping comfortably and doesn't bother you, you're okay. And then, maybe 6 weeks from then you get rid of the brace. But if you're noticing that your symptoms are persistent despite wearing a brace at night, and they're starting to get worse and worse during the daytime, or you notice your fingers are constantly numb, or your hand starts to get weak and you don't have the muscle strength you used to, those are signs that you have more significant nerve compression. And then I tell you, you really do want to get evaluated by a hand surgeon, and you want to make sure that you don't have bad carpal tunnel, because the good news is that there is something that can be done about it. Of course, nobody wants to have surgery, but we have minimally invasive options for carpal tunnel. And I can't even tell you how many patients I see in my office that have put it off for years because they have some, a friend of theirs who had a terrible experience. But I got to tell you, that's not what it's like in my office. My carpal tunnel patients are probably the happiest patients on average that we have, just because it's such a rewarding operation for the patient. Because imagine not being able to sleep for 3 months and all of a sudden your hand doesn't burn on you and you have a perfect night's sleep.
Right.
So it's pretty rewarding, and it's a small, minimally invasive surgery, about 3 to 5 minutes. And it's another one of those ones we can do with you wide awake also. You don't even have to go under anesthesia if you don't want. We give you some local anesthesia in the wrist and you won't feel a thing.
That's amazing. I mean, I would tell anybody who's listening right now, if you're experiencing anything that Dr. Lovy is mentioning, please, pick up the phone, give them a call the office. I'm going to repeat the number again, 561-922-9112. It really sounds to me that you're giving out so many options before you opt into the surgery, which I really like, and we're really appreciative of that, because we don't want to have to go into a doctor right away and they say, oh, you need surgery. So it sounds like you're very calculating on your steps before you do that, that process and procedure.
Yeah, and then the other thing that works well too is for carpal tunnel. I know we've spoken about it a little bit of length here, but cortisone injections work. They're not going to cure it for you, but one of the nice things is it can confirm for somebody who's on the fence and doesn't know what's what. If you get better after an injection, it'll confirm to you that you have carpal tunnel. And then it turns out that your response to an injection is highly predictive of how you would do long-term if you did go on to need an operation. So I find that that's very comforting for patients when they have a better understanding of their expectations, before they embark upon any kind of a surgical journey.
Yeah. So as technology continues to advance, what do you envision the future of orthopedic surgery? What do you think that's going to look like? It's especially in terms of innovative and patient care. What do you think, like, down the road we'll see?
Yeah, that's a great question. I think to me, I think that where we're going to be able to hopefully make some of the biggest improvements is really in the field of nerve surgery, because that's more of a newer field where we have all of these options that we didn't have, even 15 years ago at all. Like some of these nerve transfer procedures we do for brachial plexus injury patients who have lost the ability to, say, bend their elbow, but they have the ability to still bend their wrist in a certain way. So you can take different, you can borrow part of the nerve function from other muscles down in the arm to restore the ability to bend your elbow. So we're learning more and more about, our ability to transfer nerves, to wake up previously non-functioning muscles, and then also this neuroma pain stuff. So my hope is that we're going to end up with, better and more realistic prosthetic devices to help in kind of bad reconstruction and bad amputee settings, better technology to help our brachial plexus patients with their severe pain that they have in their limbs after these injuries. That's really, I think, a big field that we're starting to learn more and more about nerve repair and nerve regeneration.
That's fascinating to me, how you can take a nerve from one part of the body and then put it somewhere else and then have it regrow. I mean, it's like a skin graft, but it's like a nerve graft, so to speak. But that's fascinating.
Yeah, exactly. No, it's pretty incredible. And sometimes too, we can take the nerve. There's a nerve in your foot called your sural nerve that we use as a donor nerve oftentimes. Of course, nobody wants to lose the feeling on the outside of their foot, but if your option is being able to bend your elbow again versus the feeling on the outside of your foot, I think it's a bit of a no-brainer that you'd rather be able to restore your ability to bend your elbow than to feel the side of your foot, which is, not the most critical sensation.
Absolutely. So, Dr. Lovy, we actually have like a minute and a half, 2 minutes left. So before we end the show, would you be able to share? Yeah, maybe you can share a particularly memorable case or a success story or a highlight from one of the treatments or techniques that you've had at your office. We would appreciate that. Thank you. If you could share.
Yeah, I mean, I guess one that kind of sticks out to me is a patient of mine that I saw back a few weeks ago now. When he presented to me, he had a condition called Dupuytren's contracture, which is where it's a disorder of the soft tissue in the palm of your hand and sometimes in the fingers that can cause your fingers to curl down so you can't open them out straight. And this is a gentleman who, he was an executive. He traveled around the world as a businessman. It was his right hand. And in some fields, it's really important to be able to shake somebody's hand. And he really felt self-conscious about this. He felt it really was, difficult for him to be meeting with clients, and he couldn't get his hand out straight. And his fingers were almost curled at like a 90-degree angle into the palm of his hand. And we were able, it was a two-stage procedure, one to kind of pull his fingers out through a minimally invasive fashion using a device called an external fixator. And then once we were able to open his fingers out a little bit more to safely be able to access this Dupuytren's cord, we did his releases. And now the last time I saw him, for the first time in years, he was able to make a full queen fist and get his fingers all the way out straight. And that was just really wonderful. And he shook my hand, and I just remember him being so thankful for that. And that was, one of the more memorable recent patients that's on my head right now.
Well, we'll have to do that next time. We'll take a follow-up video. Next time you'll have to come into the studio, and we'll definitely speak again. But thank you so much for your time. Time is completed. Yeah, so we appreciate you. And anybody who's listening, please call Dr. Lovy at 561-922-9112. Thank you, everybody, and have a great night.